So when I first heard Dave Jones talk about the project that would become Ripples of Hope, I had this sense that it would be something extraordinary because of the way that he told me about the project. We were in this frigid kind of antiseptic hotel lobby, and I just sort of saw Dave's eyes light up when he talked about visiting the Mississippi Delta, talking to policymakers, talking to everyday people, talking to people who were engaged kind of in the work of making health equity happen in a deeply unequal place, kind of on the ground. And I think what led me to believe that this would be something significant was not only Dave's excitement, but the fact that he had told me that his visits there had really crystallized his thinking about how politics shapes health outcomes. And so I was reminded of something that the famous sociologist Max Weber said, that ideas don't come when we expect them to. They don't come when we're brooding and searching at our desks, but when we're out, enmeshed, passionately enmeshed in the world. And that spirit, that kind of passionate encountering of the world, is something that makes social science vital. And it's what makes the work in Dave's book particularly vital, and it's on every page of the book. I would say that what emerged in the book manuscript for Ripples of Hope is something that speaks to what the former president of the American Political Science Association, Jane Mansbridge, said, that the point of political science is that if political science is for anything, it is and should be for helping us govern ourselves, because political science is the one academic discipline that's explicitly organized to study how we make collective decisions on matters of great importance, including but not limited to the material conditions that influence the health of nations. So I think what's wonderful about this book is that it provides several important lessons for how we might think about doing political science for the common good. The first lesson that I think that Dave teaches us in this book is that there's a real power in combining a synthesis of existing research with an analysis of new data. One of the suppositions of the book is that you don't have to sort of reinvent the wheel or come up with the one neat trick that's going to solve health inequality. There's already a great deal of knowledge out there about the social, political, and economic determinants of health inequality. And rather than use that prior knowledge as a Bayesian statistician might to inform a set of prior probabilities, Dave uses that prior knowledge to inform, to enrich, and to contextualize the findings from his deep qualitative and ethnographic research. As a result, it becomes easier to see what I think are often pretty difficult to trace links between patterns of behavior and health outcomes, and how institutions shape health outcomes as a configuration rather than individually. And I think this is useful in part because the literature on health inequality rarely takes stock of itself, rarely considers what needs to be interpreted in light of particular conditions on the ground. And so by bringing together that great mass of research, Dave can use it to help make sense of the conditions he sees in the Delta. I think a second intellectual move Dave makes in the book, and one that I think we can learn a great deal from, is his emphasis on a kind of translational policy research. Throughout the book, Dave returns again and again to ask how his research findings from the Delta, as well as his synthesis of published research, cashes out in real policy terms. I think one of the frustrating features of writing about public policy, especially in political science, is what I refer to as the last chapter problems. In other words, you read this sort of magisterial analysis across a series of chapters, and at the end of the book, you get a sort of very rushed, almost afterthought conclusion that sort of makes policy recommendations. And this is sort of normal because the last chapter is usually the thing that one writes last, and one that, usually one has the least time to put into. Dave completely short circuits that problem by building those policy implications from each of the findings that he makes in each chapter of the book as he goes along. In other words, he really puts his own research to the test. What does this mean in a way that somebody could take action on the basis of the research findings that he's making in any particular chapter? In a sense, Dave reminds us that as scholars, as people who dive deeply into policy problems, we shouldn't let ourselves off the hook for being able to say what we think based on the research that we've done would actually begin to address them. And we shouldn't just outsource those recommendations to lobbyists, to activists, to elected officials, but we should be able to say something meaningful about what we've done. And Dave does in every chapter of the book. I think that Dave's clarity on the policy importance of each of his findings reveals, if nothing else, this sort of pessimism of the intellect, but an optimism of the will. There's a sense that pervades the book that human beings can and do take action to solve the problems that they experience on the ground, that they're not, in fact, without hope, and that even if those actions might be incremental, marginal, highly localized, under-resourced, they're evidence of collective action that demands our attention. And in fact, that's what the sort of ripples of hope in the book are. They're sort of provisional, initial, sometimes not fully formed efforts to solve the sort of dire health inequalities in the Mississippi Delta, but they're not notional, they're real, and there's something that we can learn from. And I think that that makes Dave's entire body of work, not just this book, a huge antidote to what I would call a sort of fin de sec characteristic in social science that over the last 20 years or so has presented any number of important policy problems and contradictions in the contemporary political economy, and then kind of sort of leaves them at the doorstep of the analysis of the problem itself, really sort of leaving them treated as somewhat insoluble. And I think Dave rejects that premise full stop, and that's sort of what makes the book generative. And in a way, I think the book sets up a potential for a kind of new relationship between social scientists and policy practitioners and everyday people, one in which policy practitioners and the people who experience the business end of public policy are not merely subjects of study or a downstream audience for the work, but partners in a dialogue between research and practice, one in which practice and research refine and sharpen one another. As Proverbs 27 reminds us, iron sharpens iron. Perhaps I think the most significant intellectual move that Dave makes in this book, however, is to choose to focus on a regional political economy. I think it's no secret in the United States that place matters. The health inequality literature shows that there's a huge gradient in life outcomes across the counties of the United States, and place figures really prominently in the way that the literature explains health inequality. However, I think there's a problem in the health inequality literature that often treats place or county, for example, as a unit of analysis or merely a container for other variables, poverty, race, environmental hazards. As a result, I think we're left with little to say about why place matters, if at all, what place is doing in the analysis, and in a way that I think contrasts with the experience any individual human being might have if you live in a place, especially a place where there are high concentrated indices of disease or lower levels of life expectancy. You have a sense that there's more than just a container there of a place. There's a way in which place brings together variables, institutions, politics, economics that through their conjunction shape a health outcome. So by studying a place in full, by immersing himself in the Delta, Dave makes it far easier to see how a conjunction of variables that interact with one another, often over long swaths of time, work to impose suffering on local residents. And in the book, I think Dave rejects the idea that place is merely a unit of analysis or a container by looking at the region. The Delta is this sort of distinctive context that brings together variables that shape drastic health inequalities. He's very careful about how he defines the region. He doesn't just use an off-the-shelf definition. He thinks very clearly about how the region works as a kind of organic political economic unit. As a result, I think he's able to show us both how structural factors the politics of the Mississippi State Legislature, of sort of historical legacies of inequality and voter disenfranchisement, as well as the choices of agents on the ground, co-produce health inequalities in a way that a study that just simply isolates place as a variable, or looks at it as a container for other variables, would miss. In so doing, I think Dave shows the value of this kind of conjunctural analysis rather than variable-based analysis for teaching ourselves about health outcomes in a particular place. And I think what the book raises a series of various important questions about how we do health policy in the United States. It made me think more about, for example, institutions like the Delta Regional Authority, which was created in 2000 and federally funded to provide economic assistance to the region. And despite the fact that the DRA has made significant gains, it's claimed to have created over 11,000 jobs since it was created. The question is sort of what can regional authorities or regional approaches to public policy, and approaches that go beyond what is conventionally thought of as the boundaries of health policy to include things like housing, jobs, employment, to think about the way that those lateral policies might affect health outcomes, I think requires a great degree of additional study and reflection in a way that Dave brings to the fore in the book. Dave's book also raises another important question. I think anything policy-wise that might be done to address health inequalities in the Delta is going to require federal support, but it's also going to require a level of political activation and mobilization at the local level in ways that run up against a lot of the barriers and boundaries that Dave talks about in the book. And so the book raises this question of how do you design policies that unleash positive policy feedback in a way that builds political power in a region where political power might be lacking. The beauty of the book is that even if Dave doesn't provide us with the answers, it provides us with a method for thinking about them, a method for encountering the world, a method for studying it that clarifies that we should be optimistic about what human beings can collectively accomplish. And then I think powerfully illustrates the vitality of political science for the study of public health. And I think it lays to waste the idea that we can think about health outcomes without studying politics. And I think in doing so, he challenges us to think about what can we see on the ground that might turn something like a ripple of hope into a tide. So I think that's the gift that Dave has given us and generations of students and scholars to come in a way that's going to inspire analysts, activists, everyday people for generations to think about not just how a better world might be possible, but how to make it work on the ground.